Hello friends, welcome to my laparoscopic video channel. Today in this video, I will share tips and tricks to perform diagnostic cystoscopy. So this 58-year-old female was diagnosed with cervical cancer and on MRI pelvis, mass was seen abutting rectum posteriorly and anteriorly the growth was abutting the posterior wall of bladder, and a report said that the fat planes between the mass and the bladder were lost, and hence to rule out direct bladder involvement, diagnostic cystoscopy was planned. Just to remind you all, this video is only meant for academic and educational purposes. Patient's privacy is maintained. So every gynec should be well versed with performing this cystoscopy procedure, because commonly we need to evaluate the bladder pathologies or bladder involvements in cases like cervix, and not always you will have urologists at your setup available for performing diagnostic cystoscopies. So one should always be well versed with performing simple procedures like diagnostic cystoscopies, and even one should be able to take biopsies when needed. So as you can see on the screen, at the center of my screen is the right ureteric orifice. If you see closely, you can even see the urine rippling out of ureteric orifice. So after inserting the cystoscope inside the bladder, bladder was inflated by using normal saline. After inflating the bladder with normal saline, bilateral ureteric orifices are to be examined at the start of your cystoscopy. So as you can see, I have traced the left ureteric orifice as well. Technique here is to follow interureteric ridge, which will guide you from one ureteric orifice to the other ureteric orifice. So let's come back to the left ureteric orifice again so that you'll get a good view or idea about the interureteric ridge. So the area that is being focused on screen again is left ureteric orifice and bladder trigone. So bladder trigone is a triangular area which is formed by bilateral ureteric orifices and internal urethral meatus. So again, as you can see on the screen, I am focusing left ureteric orifice. Let's have even closer view of left ureteric orifice. I'll try to focus it or give a close view of it as much as possible. Why I am stressing more over bladder trigone here is because any injury which involves bladder trigone, you should not try to repair it on your own, and you should always seek help from urologist. All other injuries which are not involving bladder trigone can be simply repaired in 2 layers with keeping Foley's in situ for around 2 weeks. So the area that you are seeing presently on the screen is nothing but bladder dome. I have also examined all the lateral walls of bladder as well, and now that marks the end of my cystoscopy. The structure, the ring-like structure that you are seeing on the screen is nothing but bladder neck, and slowly I'll come out of the bladder. These mucosal folds are lining the urethra. That marks the end of my video. Thank you.